Hi everyone,
I'm John Ryan Rodanos,
and I am Myron J. Lau. And today, we are here at Philippine Red Cross Marinduque Chapter.
The Philippine Red Cross Marinduque chapter was established on May 16, 1953. It provided humanitarian services to the community of Marinduque for 71 years. The Philippine Red Cross mission is to provide a sustained and effective humanitarian service committed to build resilient communities, run by well-trained and dedicated staff, and volunteers embedded with integrity, equipped with the necessary logistics and the maximum usage of information technology. They continue to expand their volunteer networks in every part of the country to ensure swift delivery of their services. The Philippine Red Cross vision, on the other hand, is to be the foremost humanitarian organization ready to meet the challenges and capable of rapid delivery of humanitarian services in order to prevent and alleviate human suffering and uplift the dignity of the most vulnerable. Due to the hectic schedule of the Red Cross Marinduque BOD chairman and the Red Cross organization staff, we were not given the opportunity to interview them face-to-face. However, we were allowed to submit a letter and they permitted us to use their organization for our project. We also had a brief opportunity to discuss our topic and goals with them. They also insisted on providing us with the opportunity to get our questions answered through sending us an email with their answers for our study. In the province, individuals commonly seek assistance from the Red Cross for the availability of blood for patients in critical need, Membership Accident Assistance Benefits or MAAB, Disaster Risk Management Assistance, and First Aid Training and Services. During emergencies or disasters, most individuals typically seek assistance by walking into our main office and sometimes by calling our hotline. During disaster, the PRC Marinduque chapter coordinates immediately to the Provincial Disaster Risk Reduction and Management Office or PDRRMO to gather information on actual situation report. One of the main challenges is the coordination between different departments and external partners, which can sometimes lead to delays in service delivery. For example, during large-scale disasters, ensuring that information flows smoothly between our disaster response teams, local government units, and volunteers can be difficult. In blood services, we face two main challenges in ensuring an adequate supply of blood donations for the community: a shortage of blood donors and the unavailability of a dedicated blood service facility. These challenges hinder our ability to meet the demand for blood units, especially during emergencies or periods of high need. In developing an application prototype to ensure an adequate supply of blood donations, enabling individuals to register as blood donors and schedule appointments for donation drives would make it convenient for them to contribute. Implementing a blood type matching and availability feature would allow healthcare providers to search for blood units based on type, quantity, and location, streamlining the process of matching donors with recipients. In disaster management service, we face challenges in preparedness and response to natural disasters or emergencies. One major issue is the need for offline access so our volunteers can still use critical features like first aid guidelines and emergency protocols even when there's no internet. We also need to optimize the app for low bandwidth areas to ensure it works well in remote locations or when the network is down during disasters. I would like to see features such as offline access and the compilation of ebooks about safety awareness and training programs offered by the Philippine Red Cross Marinduque. Having offline functionality would allow Red Cross volunteers to access essential information like first aid guidelines, emergency protocols, and contact information, even in areas with limited internet connectivity during disaster response missions. From the Red Cross perspective, a mobile application offers improved communication and coordination during emergencies. but it requires resources and may face adoption challenges. For the community in Marinduque, it provides easier access to Red Cross services but could exclude those without smartphones and digital literacy. As an organization committed to serving the community in Marinduque, we recognize the potential of new technologies and digital solutions to enhance our service delivery. We understand the importance of staying adaptable and open-minded to innovations that can improve communication, coordination, and efficiency during emergencies. As the Philippine Red Cross Marinduque chapter, we want a mobile application that aligns closely with the Red Cross mission and vision in our community. Key features we'd like to see include blood donation scheduling, disaster management resources for preparedness and response, educational materials on safety topics, streamlined membership insurance processes, and a platform for RC143 volunteer registration.
Introducing Red Cross CareConnect, an innovative app designed to provide seamless access to Red Cross humanitarian services through a single user-friendly platform. Our goal is to revolutionize how you connect with vital services, making them more accessible and convenient than ever before. The app's distinctive features include a convenient platform for blood donation, disaster management, basic first aid topics, and charitable donations. With Red Cross CareConnect, you can effortlessly locate nearby blood donors, be a blood donor yourself, and schedule appointments with ease. Additionally, through our disaster management feature, you can stay prepared for emergencies by accessing educational materials, receiving disaster updates, and reporting incidents offline. Our app also provides basic first aid information that can be accessed offline to allow users to acquire fundamental knowledge about first aid. By harnessing the power of modern technology, we empower you to support various charitable causes through simple, secure e-money donations. Whether you're contributing to disaster relief efforts, funding ongoing humanitarian projects, or supporting community initiatives, your generosity makes a tangible difference in the lives of those in need. Experience a new level of convenience and efficiency with Red Cross CareConnect, where essential humanitarian services are just a tap away.
And you know what? I like it.
In this app, as you can see in the use case diagram, people have the option to create, sign up, or sign in using their existing social media accounts such as Google, Facebook, or Instagram. If they forgot their password, they can reset it through various methods, including sending a one-time password or OTP code for verification. The app offers various humanitarian services that are easily accessible, including a platform for blood donation, disaster risk management, basic first aid, and donation assistance for those in need. In the blood donation service, users can either locate nearby blood donors or become a blood donor themselves to assist patients in need of blood. This section includes an eligibility checker, where users can undergo a test to determine their eligibility as blood donors. They can also fill out forms with personal information and verify their identity by scanning their identification cards. Users can become blood donors by using the app's search function to find nearby patients in need of blood. They can filter their search by location and blood type preferences, accessing a list of nearby patients with detailed profiles. If the user wishes to donate blood, the users can initiate the donation process by tapping the Donate Now button. As part of the donation process, donors will fill out a donation form specifying their blood type, the number of units to donate, and the preferred date and time. Donors can also track the progress of their donation from registration to the final provision to the intended patient. And upon completion, donors can view and receive their rewards with corresponding benefits. When users require blood and seek nearby donors, the app streamlines their search process. They can filter donors by blood type and location, accessing detailed profiles of nearby donors. If a suitable donor is found, users can request their blood via the Send Request button. The system updates users on the donor's response and provides a blood donor progress tracker to monitor the donation process. Users can track appointment scheduling, arrival, donation status, testing, and delivery to the hospital. After completion, recipients can rate donors and submit reviews, enhancing community feedback. The app also has an appointment scheduling feature that allows potential donors to schedule their blood donation appointments based on their availability. In addition to those functions, the blood donation service also offers a donation history feature to provide users with a record of their past contributions. Furthermore, it includes an impact tracker that monitors the patient's condition, specifically tracking the impact of the blood donation on their health. The app also includes a messages section where users can view and manage communications. Additionally, the requests section notifies users when someone sends them a blood request. The Red Cross CareConnect app offers more than just blood donation services. It also provides disaster management features. The Disaster Risk Management, or DRM, notifies users of nearby disasters and offers immediate access to resources through an emergency button. Users can report emergencies, access weather updates, and find evacuation plans tailored to their location, even when they are offline. Additionally, the app offers disaster preparedness features, providing users with information on various calamities to help them prepare. Users can access different topics aimed at enhancing their readiness for disasters. The app offers donation services, allowing users to support charitable causes. On the donation homepage, users can explore categories for different types of donations, view recent causes, and learn about each cause's goals. Users can access detailed information about causes through articles and select advocacies to support. The article page provides insights into project objectives, donor engagement, and donation statistics. In the donation options section, users can choose donation methods such as mobile wallet, bank transfers, or in-kind donations. Mobile wallet options display QR codes or Red Cross GCash numbers, while bank options show available bank accounts. Detailed descriptions for in-kind donations include needed items and delivery instructions. Upon tapping Donate Now, users can select donation amounts, set up monthly donations, and confirm transactions. A processing/loading screen follows, concluding with a thank you message. Users also have the option to share campaigns on social media platforms. Lastly, the app also offers basic first aid learning resources. The basic first aid section covers essential topics such as CPR techniques for adults, children, and infants, providing detailed steps for each category. Visual guides accompany the instructions for accurate execution. Users can also find information on first aid for various situations like bleeding, choking, poisoning, and bites, enabling them to respond effectively in emergencies. In the user profiles, key personal details such as name, email, phone number, and address are shown. Additionally, the Activities Overview section provides analytics on daily activities, which help the user to manage their engagement and interaction within the app. The app also has a menu bar that provides access to various interactions, including notifications, settings, help and support, and about us. Additionally, they have the option to switch accounts or log out as needed. In the admin account, the admin logs in with their username and password and first sees the dashboard. The admin dashboard provides key analytics, including metrics for monthly charitable donations, disaster management incidents, basic first aid topics, and blood donations, offering insights into the app's performance and impact. In user management, admins can view metrics like total users, active users, and new registrations. They can also edit or delete inactive user accounts for comprehensive user management. The Admin Notifications panel displays updates from various app features, keeping administrators informed about important events and activities. The Charitable Donation Analytics dashboard shows metrics such as total donations, recent donations, and donor information, offering insights into donation trends. The Blood Donation Analytics dashboard provides insights into blood donation trends, including monthly donations, top donors, and donation outcomes. The Disaster Management Analytics dashboard showcases metrics on emergencies responded to, people assisted, volunteers deployed, and active emergencies, with features to edit and update disaster information. The Basic First Aid Analytics dashboard presents metrics on topics read, updated, and pending, allowing administrators to manage and monitor first aid learning progress. Once again, this is Red Cross CareConnect, your most interactive, user-friendly, and convenient application that would bring humanitarian services to a modern level.